Anatomy, musculoskeletal system, maxillary bone. The maxillary bone is probably the most important facial bone since it articulates with most of its other bones. It is involved in formation of the orbit, its base, the nasal cavity, and the oral cavity. It is therefore a key bone for the facial bones. Moreover, it contains a very large paranasal sinus inside. But let's analyze the bone in detail. The maxillary bone can be described in terms of aspects and processes. The aspects are anterior, medial or nasal, and posterior, in addition to the upper aspect, which is considered an orbital process, and the lower aspect, which is considered a palatine process. Let's start by describing the anterior aspect. The anterior aspect has a roughly triangular shape, as you can see, right below the orbit, and we can find the infraorbital foramen that the branches of the maxilla emerge from. It is limited at the top by the nasal processes, by the base of the orbit, and by the zygomatic process. At the bottom, it has some protuberances that are due to the presence of teeth. Its medial aspect has a triangular-shaped opening that is precisely the piriformis incisura, where at the base there is a spine called nasal spine. If, on the other hand, we move to the medial or nasal aspect, the first thing that catches the eye is undoubtedly this large foramen, the maxillary hole, which leads to the maxillary sinus, easy to observe with bone dissection. Significant in this region for the nasal structure is also the conchal crest in front of the maxillary bone, which represents a point of attachment for the lower nasal concha. There is also always in front, but higher than the maxillary foramen, a canal, that is to say, the so-called lacrimal incisura. The lacrimal incisura, articulating with other bones, including precisely the lacrimal bone, contributes to form the nasolacrimal canal, which comes out at about the level of the first cornet, the lower one. And the same aspect is the posterior aspect of the frontal processes. In the posterior part of the medial aspect, you can see the palatine fossa that, by articulating with the pterygoid process of the sphenoid and with the palatine bone, forms the pterygopalatine canal, where the maxillary nerve runs. Let's now turn to the upper aspect, or orbital process if you prefer. It has a roughly triangular shape and a structure. The entrance hole of the infraorbital canal that can be seen on the frontal side. The infraorbital canal is a passageway to some branches of the maxillary bone, and by dissecting the bone, we can see that smaller caniculae originate from this canal and form the nervation for the anterior teeth. Finally, the posterior aspect, also known as infratemporal, has a tubercle called maxillary tuberosity that houses a large maxillary sinus, features the posterior aspect of the zygomatic process, and the alveolar foramina, still for some branches of the maxilla. The alveolar foramina, however, innervates the posterior teeth, mainly molars, that therefore have a different path of innervation. The four processes that the bone is equipped with are the zygomatic process, which articulates with a bone of the same name, thus forming the zygoma; the nasal or frontal process, which articulates with both the nasal bone and the frontal bone to form the bony part of the nose, which we described as the superior aspect. Then there is the palatine process, a lamina with the contralateral bone to form the anterior part of the palate, and which, posteriorly, at this margin, articulates with the palatine bone. Finally, there is the alveolar process, which consists of a series of holes in the lower aspect of the jawbone to gather the gymphosis with the teeth. As you can see, the shape and the number of foramina depends on the type of articulating tooth. This video was created thanks to Anatomy Learning, an interesting free web app. The hyperlink can be found in the description. Instead, the text used for the concepts is Human Anatomy of Eddie Hermes. Thanks for watching.